Respiratory examination. Again, 4 important steps. What we learn. First, we have to take consent of the patient. Do not harm. Right? Any ways. Physical, verbal, gestural. ठीक है. बाद में हम लोग ने देखा light. We have to examine in proper light. And fourth one था at same level. Now I am at same level with him, so that I will have a good observation. Right? Coming back, respiratory examination. So we have to examine lungs, heart. ठीक है. First inspection, right? So we need to be use a trick that while taking pulse of a patient. So as we all know, basic rule is we have to start from distal part of our body to proximal. So pulse लेते ही, if suppose I am calculating pulse for total 1 minute. So if in 15 minutes, 15 seconds I have calculated कितना pulse है, into 4 करके I can get 1 minute वाला pulse. And rest all things I can observe a movement, abdominal or this movement, so that I can come to a respiratory rate. Normal respiratory rate कितना रहता है 1 minute में?
12 to
16 to 18, roughly from 14 to 18 we can say. So directly देखने जाएंगे तो patient might feel bad. अरे क्या डॉक्टर क्या देख रहे हैं? It is like that. So we have to just simply या patient को पेट पे हाथ रखने को बोलने का, and we have to just observe कितना टाइम ऊपर आ रहा है. So it is like I am same time calculating pulse हो जाने के बाद I am focusing on respiratory rate. ठीक है, high respiratory rate की causes are अलग, shallow की अलग, right? It's a different story. Just today we'll focus on clinical examination. So RR is done by simply doing pulse. ठीक है? So and inspection में we have to see type of chest कैसा है, barrel shape है या kyphosis is there, is it affecting respiratory area? अगर if I am a bended like this, so my respiratory area is बहुत कम मिल रहा है, so less oxygen intake will be there. इसलिए हम लोग को बचपन में मारते थे सीधा बेड. So one of the reason is that good posture and body can take more oxygen. More oxygen means more concentration and will study hard. That way, right? So we have to check for postural deformities, posture, right? Inspection हो जाने के बाद we can touch, right? So now touching, that is always in examination we write in exams AEBE, air entry bilaterally equal, right? So simply by observation also, या फिर on auscultation we can check. By palpation we can check if a gents person is there, right? If a guy is there, we can keep hands like that. And now take a deep breath. So distance between my hands, my thumbs will increase W, and ask patient to turn their face to on opposite side, because otherwise infectious disease you will get at no cost, free download, right? So we have to ask this and ask patient to take deep breath. So these are important minor things we should learn. Now ये distance बढ़ गया, right? Now he is gymming इसलिए, right? So it is good. So air entry bilaterally equal we can check by this. Palpation में we have to feel lymph nodes वगैरह. Examination we have seen axillary lymph node, then cervical lymph nodes, right? Palpation हो गया. Now comes the important auscultation. We'll learn in little shortcut जब time कम है तो कैसे फटाफट examination we can do. So auscultation में it is 9-point auscultation technique, and हर एक point दूसरे side पे like in surgery we do always compare. We have to always compare right with left. So right lung with the left lung. So 9-point auscultation is that we have to put stethoscope. ठीक है? Then in anatomy we have learned that apex, middle and base of the lungs, right? So we have to check first these 3 points, right? Simultaneously. So comparative study will be there. So air entry we can also observe by doing this. So I will observe apex of right lung. Ask patient to turn, right? Gently, politely we have to ask. Look at that side and take deep breath. If उसको सर्दी खांसी nose block रहेगा तो you can even ask him to take breathe from mouth. तोंडाने श्वास घेतला तरी चालेल, ठीक है? लंबा सांस लेना. So I am checking this apex, ठीक है? Just then after this apex I will compare middle. Either I will get the heart beats, right? Then base. ठीक है, these 3 points comparatively over. I am talking about 9 point on one side, so total will check 18 points. So 3 point इधर हो गए, ठीक है. Then comes the in lady patient, for you can do this examination front से नहीं किया, back से किया. Let's suppose now turns, right? So पीछे भी हम लोग chest anterior side भी examine नहीं किया due to the breasts are there and if you are conscious. So good practice is that you can also examine her back and come to the conclusion, right? So ask patient to give this position. Assertive, right either, left either, shoulder, right? And now look down so that I am avoiding infections, right? Deep breathing. Now at this time, posteriorly 4 points we can auscultate. First is suprascapular. Scapula is the center, ठीक है? So assertive. So now scapula becomes the prominent, right? So now you know the position of scapula. Now I again take this position. Now I know the position of scapula. Okay, so suprascapular, then scapular, 2 point हो गए, then infrascapular, inferior angle of scapula, infrascapular, and then interscapular, मतलब this is vertebral column, partition है, border is there, so between the border and this right scapula I will place. So ये साइड पे 4 पॉइंट हो गए, suprascapular, scapular, infrascapular and interscapular. Point's name is interscapular. Same ways, suprascapular, scapular, infrascapular, interscapular. So total, it's on posterior side you are examining lung. And by this position there is winging of scapula and you get maximum area to auscultate lungs, right? So this is 4 point. In ladies generally, I in my personal practice do this examination, back examination. Okay, now coming back in heavy loaded practice, जब तुम लोग के पास time नहीं है तो for this 9 points auscultation, so at least you have to do this inferior scapular वाला auscultation. It gives you a position, means at least it is a nutshell, conclusion point. No point नहीं किया और इसमें से एक किया तो भी चलेगा that way, ठीक है? So 4 हो गए, आगे 3 हो गए और साइड में एक्सिलरी में supra axillary and infra axillary. These are 2 points. Supra axillary, infra axillary, same way. Supra axillary, infra axillary. So total 4 इधर, 2 4 plus 2 6 and आगे 3. Total 9 point auscultation. So we are trying to take conclusion or examining lungs from this direction. All possible directions we are taking. These are the 9 point auscultation. Yes, coming back. Now another. If you don't have a stethoscope, what you can do? So there is P.G.D.F method. That is tactile vocal parameters. So in between the ribs, now scapula is there. From front side you can do, from back also. You have to ask patient to say number like 999 9 continuously keep saying 9. So there is a particular vibrations you will feel here. It is called tactile. Tactile is touch. Vocal is vocal. I am asking patient to say some number 1 1 1 100 100 100 99 99 99 and tremulous means I am feeling that vibrations. So I can lung consolidation, pneumonia I can differentiate, right? So again 999 okay, turn around. ये बैक पे देखा किधर एस्पेक्टेट करने का एंड फ्रंट में बिटवीन द रिब्स वी कैन प्लेस लुक देयर एंड से okay, so this is tactile vocal parameters, very important. And last one, percussion. You can percuss line position. Now we is sitting, so line में we can do percussion, same abdominal percussion में. So hitting middle fingers, middle phalanx. It is like a vertically we have to hit with right hand. I am a right-handed, so I will use my right hand and gently. नारियल कैसे हम लोग जज करते पानी है कि नहीं? It's like that. Consolidation. Is there any consolidation? Different sound, right? Feel. Okay. So in between the ribs you have to check. Okay. So in inspection we have inspected posture or a chest position. Kyphosis है क्या? Abnormal gait is there. Scoliosis is it affecting lungs area of expansion, right? Rib fractures वगैरह. Means X-rays will be helpful, but in clinical examination there will be a pain if there is a rib fracture वगैरह. All that criteria will fall in, right? Paradox pulses are there, right? So we have to observe the pattern. So first we are going to try RR देखा हम लोग ने, respiratory rate, then क्या देखा inspection में? Various deformities, then swelling tenderness, right? मतलब कुछ fracture है, costochondritis है, so we'll check that. Then inspection हो गया. Palpation में what we did, this air entry, bilaterally equal. Then inspection, palpation I have showed you, consolidation, right? So we can check, right? Then auscultation में 9-point auscultation we have seen, right? So कौन से थे? Front में apex, middle, base. Back में suprascapular, scapular, infrascapular. 4 पॉइंट हो गए. और साइड्स में क्या पोजीशन कैसे देंगे? It's like and supraaxillary, infraaxillary. Very good. And last one was tactile buccal parameters. Means वो 9, 9, 9, 10, 10, 10. Consent is important and ask patient to turn face to opposite side. Okay? So that's it for today. We'll stop here. Thank you.
Patient को
Pause.